I'm Dr. Rashmi Chakraborty, a visiting neuropsychiatrist at Narayana Superspeciality Hospital, Howrah. Today, use of psychoactive substances has become socially acceptable and culturally popular for various purposes. It might be recreational purpose, relaxation, or relieving anxiety. The substance may be alcohol, opioid, cannabinoids, or even caffeine, nicotine, etc., etc. But when do we say our pattern of substance use has become problematic? International Classification of Diseases gives a clear-cut definition of dependence. It says, a cluster of phenomena which are behavioral, cognitive and physiological. I will give you the list. First is craving, a strong compulsion to take that substance from time to time, tolerance to the rewarding effects if the substance is taken in lesser quantities. Third, when you are trying to cut down on the substance or quitting it, it leads to a physiological and physical and psychological discomfort. Fourth, loss of control over that substance use in terms of onset, duration of use or termination. Fifth, continuing with the substance use when the adverse effects or the adverse consequences one is well aware of. Lastly, giving that substance a higher priority over other activities and behaviors which earlier had a higher value. If any of these above three have been repeatedly occurring over the past 1 year or continuously over 1 month, then your pattern of substance use falls in the category of dependence. To make it more simply, let's talk about alcohol use. If you want to know your alcohol use has become problematic or not, just ask yourself these 4 questions, which is covered under the acronym CAGE, C-A-G-E. Have I thought about cutting down on my alcohol frequently? C. A is, do I get annoyed when other people criticize my alcohol use? G for guilt, do I feel guilty or bad after drinking sometimes? E, do I use alcohol as an eye-opener in the morning to steady my nerves or get over hangover? If at least 2 of these questions are yes in your answer, then your drinking is problematic. In our Indian society, 22.9% of the adult population are addicted to some substance or the other, and more than 5% to alcohol. This is not what I am saying. This is what National Mental Health Survey brought out. Many times, friends, family, or we think it's all about willpower. I can quit many times. I have quit many times. I can easily quit it. But let me tell you, when you take these chemicals, they act on the receptors in your brain, on your neural circuits, and they lead to release of certain neurochemicals like dopamine, etc., which gives an intense sense of relaxation, pleasure, contentment. But with repeated regular use or use over prolonged period, there are definitive changes that takes place in one's brain, which paves the way to harmful or dependent pattern of substance use. Why do you want what nature has given as a rewarding circuit in your brain to be hijacked by some externally taking chemicals? We are here to help you. Seek counseling, seek treatment. If your mind is healthy, your world is beautiful and your days are happy. Thank you.